Hello everyone, this is Dr. Shishma Sirilla, consulting homeopath at Fidicus Homeopathy. Next, coming into the investigations part. So what are the investigations you need to do if you are suffering from Telogen Effluvium condition? The first and foremost is history and physical examination. In that, there is detailed history. If you are suffering from sudden hair loss after an event, what are the events? We will be discussing it in the causes. But if you are suffering from sudden hair fall, without any, you have not noticed any sort of a hair condition before, but suddenly you have started it, suddenly there is hair thinning, suddenly there is widening of the scalp, suddenly there is hair discoloration and there is pain in the root, then you should go to a doctor, have a doctor consultation where they will be taking the history part. If they will notice any sort of physical stressful history or an emotional stressful history, they will tell you certain investigation. So the first one is physical examination. We have already heard about this physical examination in male pattern and female pattern baldness. That is the pluck test. What is the pluck test? They will be taking a section of your hair. They will pluck it like this. And when they do that to overall hair, all over the scalp, taking sections, if there is more than 10% hair fall or hair coming out during the pluck test, that is positive for hair fall. As you can see here in the picture, pull test or pluck test, if it is negative, then there is different condition. If it is positive, it is either telogen effluvium or alopecia, that is hair fall due to androgenic causes, that is male pattern and female pattern baldness. Then coming to the other types of tests. Remember, as I told you, it can be a physical stressful event. So what is physical stressful event? Any sort of viral infection, acute bacterial infection, or it can be any sort of surgery that you have gone through or chemotherapies that you have gone through. All of this can come under physical stress to the body. It can be oxidative stress because of certain crash diets that you're doing. All of this will come under physical stressful events. So to know if there is any physical stressful event or any infection or any inflammation in the body, you need to do certain tests like CBC, which is complete blood count, where in the WBCs or in the RBC you will see if there is any sort of iron deficiency anemia, where there is fall in the PCV, packed cell volume, MCH, MCV values, and also the WBCs represent if there is any infection. If there is an acute infection, acute means sudden rise of temperature, it can be fever or anything which is less than 6 weeks in nature. If there is that, there will be rise in the neutrophil count. If there is chronic infection or inflammation in the body or allergy in the body, you will have lymphocyte count raising and also the eosinophil count raising if you have any sort of allergies. So to know all of these, you need to do a CBC. Iron and ferritin levels, if you are having iron deficiency anemia or if you are having any sort of anemic condition that the doctor will notice, they'll ask you to do an iron and ferritin level. Vitamin D, vitamin B12 also, if you're having low absorption rate or if you are not taking enough food or if you're not being exposed to sunlight, that can also lead into telogen effluvium. Thyroid fluctuations are very important in people who are in their starting stages of thyroid will have telogen effluvium condition. And also raise in the ESR, which is erythrocyte sedimentation rate, which occurs in any sort of infection, either viral or bacterial. You will be having a raised ESR. If you're having a raised ESR after an infection, it will stay for some time even after an infection. So if there is raised ESR, that means there is physical stress which can lead into telogen effluvium. Next, what are the other kinds of tests that you need to do? According to, like, we have done the blood test, right, and the hormonal test. Now we need to do tests regarding the hair. So what are we doing? Trichogram, pictotrichogram and trichoscan. What is trichogram is that, as you can see here in the picture, they will pull out the hair and then they will be viewing under the microscope. This is called as trichogram, and the pictorial representation of it is called as phototrichogram. And then you have the third one, which is the trichoscan, where they will be telling you, how many follicles are arising from a single given area section and how is it, how dense are it, all of this will come under this. Next, apart from that, you need to do other investigations for your hair, that is dermatoscopy and scalp biopsy. When to do dermatoscopy? If you feel that there is any sort of scalp condition, to exclude scalp diseases, you need to do dermatoscopy. And also if you're not able to understand any sort of underlying causes, then you have to do a scalp biopsy. Here whatever you're seeing is called as dermatoscopy of the scalp, and here whatever you're seeing, that is the punch test of the scalp, that is called as scalp biopsy. See, if in the all the physical examinations or the investigations that we're doing, if there is nothing that you can trace out to be the cause of telogen effluvium, then we go into this section. Usually we will do the basic section, that is the CBC and hormonal test along with the trichogram test. Now coming into the consultation part, if you are suffering from hair fall issues and you would like to get in touch with us, we have two types of consultations here at Fidicus Homeopathy. One is the offline consultation or the in-person consultation. If you're staying near the nearest branch of Fidicus Homeopathy, you can come and consult us in person. And if you're staying far away from us, you can consult us through audio or video online consultation. Okay, and after the online consultation is over, or after the consultation is over, we will be asking you for the investigations which are needed. If you have already got it done, you can share it with us. And after this part, especially to the online clients, we will be sending you our medications to your doorstep. If you're staying in India, it can take 3 to 4 or 3 to 5 business days. If you're staying in USA, 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our good medicines to reach your doorstep. If you would like to get in touch with us, you can call us, WhatsApp, ping or messages on this number which is displayed here. And also, if you would like to know more about us, you can check our website www.fidicus.com. If you're watching this video and you're suffering from hair fall or hair fall issues and you're looking for cure, why should you choose Fidicus Homeopathy? Here at Fidicus, we stand for highest chance of health and we follow 3 principles. What are that? First one, we are already having good success in hair fall cases. Second thing is our transparent treatment here at Fidicus. There is no gray area between the patient and the doctor. Here we will be talking to you about your case and also about your prognosis and the personal care here at Fidicus Homeopathy. What is personal care given? If you're having any sort of queries, if you're having any sort of doubts, if you're having any sort of fears regarding this hair fall, all of this, you will be educated on that and you will be given proper, education on whatever issue you're suffering from. So if you're wanting to choose cure, choose Fidicus Homeopathy. Thank you.